All right, hello guys. We're gonna go right into strand 3, standard 2 and 3. So this is where we get injury classifications and common fractures. This is gonna be a quickie because we've gone over most of these in other kind of contexts with the other units. So here we go, or not. There we go. Okay, so when you have soft tissue injury, that usually means that you've overstretched it or you've done rapid stretched it and you've torn it. So in this case, if you have a first degree strain or sprain, so strain if it is a tendon, or a muscle or tendon is going to be strain. If it's a ligament, it will be a sprain. So first degree is just a micro tear. Second degree is when we actually get a moderate tear, and as we go higher, obviously the third degree is going to be the worst possible case scenario. A second degree strain or sprain would give you moderate pain, moderate swelling. It'd take a little more time to heal, but it's a partial tear. And then the third degree is when it's a complete rupture, severe pain, likely in need of surgery. Well, yeah, you're gonna need surgery, buddy. So in concussions, this is going back to the beginning of the year because we did concussions at the beginning of the year. They have classifications too, and it's kind of the same grading system, 1, 2, 3. So a grade 1 is mild, and we're basing it on different guidelines. So you can see here we've got 3 different reputable organizations that are saying, like, this is how we classify it. So a mild one, post-traumatic amnesia, less than 30 minutes, no loss of consciousness, all the way up to, if they hit their head hard enough, then you're going to end up with loss of consciousness. If it's greater than 5 minutes, scary, amnesia, or greater than 24 hours. Remember, too many concussions can lead to CTE, which is chronic traumatic encephalitis, which is that brain disorder that we talked about, mostly NFL players, but also hockey players and women's soccer, all of that stuff. This is one that we will watch after the fact. So acute injury, we talked about acute injuries last time. We can pinpoint it to an exact time when it happened. So I'll have you watch this video at the end. We'll have this kind of thrown in so you can see it. Here is some content that is questionable, but this is Kevin Ware's tibia sticking out of his leg. So he had a compound fracture. That means that the bone comes through the skin. We could classify his injury as an acute injury because he jumped, and we can say, like, oh, his tibia snapped here. But a lot of times there's an underlying chronic condition that's happening, and we don't know this for sure, but we've kind of speculated, well, if he has been running and jumping and kind of ignoring shin splints for a long enough time, that tibialis posterior can push into the tibia and kind of tick, tick, tick at that bone. So when he made that jump to block the shot, crack. It's kind of gross. Have you seen the one with the Lion King, like Simba's up on it? Kind of funny. Okay, some common fractures that we have. I think we talked about this in the vocabulary notes. So if you've heard it more than once, not even sorry, because actually the more you hear it, the better you get at it. So, and in fact, if you decide to teach it, teaching it is the best way to learn it. A compression fracture, if you think about helmet-to-helmet contact, so spearing, that is illegal in football. If you do that and kind of compress the disc as you come in, that's a compression fracture. And that's why they're saying heads up, shoulders down when you go in for a tackle. You can have a depressed fracture. So this is on this slide right here. You can see someone hit him with a hammer or something. But usually blunt force trauma where that would happen. Here are some different long bone fractures. So let's just kind of go through them. Here's a good normal femur. Here's a transverse, which means it just cuts it in the transverse plane. Oblique means like a diagonal blow, I guess. And then a spiral would be like, sometimes it's kind of a twisting action, and it causes the bone to split in a spiral fashion. And then comminuted, it's almost shattering a little bit. So you could have, I'm wondering if I've got another one. This I don't. This could be like a crush injury. So if something ran over his leg or something. Segmental, we've cut it in a couple of places. Avulsed is just kind of the tip of the bone. Impacted, you can see like this part has kind of crunched in, so the bone has come together a little bit. This is happening here too in this Torus fracture. And then green stick, we've talked about, is when you like break it, like when you break a live branch, it's hard to break all the way through. That's kind of where that name comes from. So here's a varus force versus a valgus force. We've got some rotational forces that could cause these breaks. And I'll throw in these videos at the end so you can kind of see some injury videos. It's sports med. We're supposed to do that. So that's it on injuries. I will, let's see, today is Wednesday. It's hard to even keep track anymore. So this will come out tomorrow, and then it will be Monday after that. So have a great weekend.